Now, victims of the contaminated blood scandal here will have financial support payments increased to match those given in England. The scandal, which has been described as the worst in the history of the NHS, resulted in people who had haemophilia being treated with infected blood, which had hepatitis C or HIV, back in the 70s and 80s. Well, last year, a public inquiry heard the stories of those affected. Paul Kirkpatrick from Derry is one of them and is part of the lobby group Friends and Family NI, which has been campaigning for payment parity. Good morning, Paul.
Good morning, Amanda.
First of all, could I get your reaction to the news that there will now be payment parity for people in Northern Ireland affected by the scandal?
Well, naturally, we welcome it. We have been campaigning and lobbying with the government. Unfortunately, they could have done this a long time ago and indeed promised it way back in March, but the plans continue to change and it's taken numerous months to get to this point. We're nearly parity. There's a few differences, but not quite as bad as it could have been, so we welcome it.
How much of an impact has this had on your life?
I think, people don't realise that it's quite significant, and this has been going on for decades. So individuals are dealing with a very difficult illness in haemophilia in itself, which affects both your blood clotting, your joints, leads to a severe form of arthritis and whatever. So it does impact you throughout your life. And when you add the threat and fear of AIDS, followed by CJD, and actually almost 100% of haemophiliacs did get hepatitis C, and the potential life-threatening impact of that, it's huge. It can't be underestimated. Is
this payment perhaps just a little too late?
Very much so. This is a scandal that has been going about since, as you said in your introduction, since the 1970s and 1980s. Unfortunately, a number of people have actually passed away. Some are in their later stages of life, and they've been struggling for years and years. And their families that they've left behind, particularly the wives, partners, mothers, fathers and siblings, have been struggling for years without their loved ones. In many cases, it's been the breadwinner within the family that has passed away, and they've been forgotten about. So although today it's very much focused on those that are still alive and receiving this benefit, there is a group of people who have suffered immensely over the years.
Will they be entitled to anything at all?
We hope so. The four nations are different, have all got different schemes. If you look at the Scottish scheme, they very much look towards the bereaved and try and support the families of those who have died, and that's something we want to encourage, we want to get, and we welcome the fact that Minister Swann has actually commented that they're currently reviewing that. So in the past 24 hours, I have sent them an email, thank them for the uplift, but ask them to really look at these forgotten families, the forgotten parents, the forgotten wives and the forgotten children, because they too have suffered enormously, and in some cases they've had to do without for 20 to 30 years.
Do you know when these payments will be made? Robert Swann said that people will get letters in the next few weeks. Have you any idea of a timeline there?
Yep. He indicates it by October this year, so it should be relatively straightforward because the scheme has been set up. He actually did uplift payments back in March for the financial year 1920, and he indicated that would continue into 2021, but it didn't, so we had to go back around the same circle. The Department of Finance were very proactive. They issued the money to the Department of Health, but for some reason since April they've been sitting on that money and kept it within themselves. So hopefully they're able to release it now within the next month or two.
And just finally, Paul, the Minister, Robert Swann, said that all those affected by this scheme would be surveyed, is how he has phrased it, to assess their feelings on the level of financial and psychological support that they've received. I mean, you talked about just how difficult the process has been and how challenging life can be for people affected by this.
You know, it is very difficult because people have shared their very private stories, and that's not easy in public. You know, in May of last year, the inquiry sat in Belfast, and quite a few of us opened up for the first time in our lives, and a lot of information we gave out, which is very, very private, which is very, very difficult to do. And one issue that's coming forward is that the local clinicians who looked after us in that stages are due to give their witness statements, but there seems to be some issue. Northern Ireland has not been included on that list because there's ongoing legal discussions between the inquiry team and the medical doctors who presided at that time, and that's adding additional stress. So it's not just about money, it's about getting answers, especially for those who passed away and their families, and for those still living there. There's an awful lot of questions that need answered as to why we were given contaminated blood and how much was known about it over those years.
Paul, thanks very much indeed for your time this morning, and please do keep us updated on what happens with those discussions as well. That's Paul Kirkpatrick there from Derry, who is part of the lobby group Friends and Family NI.
Victims of the contaminated blood scandal in Northern Ireland have welcomed an increase in support payments to match those given in England. Described as the worst scandal in the history of the NHS, it resulted in people with haemophilia being treated with blood infected with hepatitis C or HIV during the 1970s and 1980s. Paul Kirkpatrick from Londonderry is one of those affected. He gave evidence to a public inquiry last year.
Naturally, we welcome it. We have been campaigning and lobbying with the government. Unfortunately, they could have done this a long time ago and indeed promised it way back in March, but the plans continue to change, and it's taken numerous months to get to this point. We're nearly parity. There's a few differences, but not quite as bad as it could have been.
Northern Ireland's #1 for music.
It's 8 o'clock. I'm Chloe St John. The contaminated blood scandal's Northern Ireland victims are set to have their payments up to bring them in line with England. Sarah McKinley reports.
We're talking about patients who became diagnosed with hepatitis C or HIV after receiving NHS blood or blood products that were infected. It's thought as many as 4,000 were impacted UK-wide. There is an infected blood payment scheme already to give those people compensation, but they were getting a lot less money than anyone the same thing happened to in England, because the English payout went up in April 2019, but the power sharing impasse prevented the same action here. So a group called Families and Friends of Haemophilia NI wrote to the Prime Minister saying victims in Northern Ireland were not being treated equally. Now the Health Minister Robert Swann confirmed increased annual payments range from nearly £19,000 a year to £45,000 a year, depending on diagnosis. It'll cost his department £1.1 million, but he says he hopes it provides financial certainty to people who have suffered tremendously.